ACB logo, ribbon below, 60th anniversary.
We are fortunate to be joined by Alison Barkoff. Several of us who've been a part of ACB and worked especially on staff at ACB and here in the Washington area with the consortium of constituents with disabilities. Alison is no stranger to us, but Alison is in a new role, and Alison Barkoff is the acting administrator and assistant secretary for aging at the Administration for Community Living, which is part of the U.S. Department for Health and Human Services, for HHS. So Alison, welcome to the ACB Leadership Conference and Legislative Seminar.
Great, thank you, Clark, so much for the introduction. And let me just start by giving a brief visual description. I'm a middle-aged white woman with curly brown hair, white skin, wearing a blazer and a watercolor-ish blouse with logos behind me of HHS and ACL. And I really appreciate the opportunity to speak with all of you today to share a little bit about ACL's mission and priorities, and to really acknowledge all of y'all's incredible efforts and advocacy. For those of you I haven't had the chance to meet before, let me start by sharing a little bit about my background. As Clark mentioned, I've been privileged to join the Administration for Community Living, and I joined on Inauguration Day as the Principal Deputy Administrator, and I am currently serving as ACL's Acting Administrator and Assistant Secretary for Aging. At ACL, we believe that everyone has the right to live and fully participate in their communities, regardless of age or disability. And our disability programs and policy advocacy are focused on maximizing independence, well-being, and the health of all people with disabilities. The mission of ACL, supporting opportunities for community living for all, has been my own life's mission. I've been involved in disability rights and advocacy around community living for my entire life, and I have had the experience advocating alongside people with disabilities, families, and advocates from across the country. And it's really shown me the importance of coming together to implement positive changes and working in coalition. I've worked on policy change at the national and state levels, and my work has always centered on the principle that community living is a civil right, and it's possible for everyone, regardless of type of disability, level of support needed, or age. And I truly believe we are making progress together in many of our shared goals. And at the same time, we have a lot of work to do together to ensure full and equal access to all aspects of community life, from schools to workplaces to healthcare to transportation and all of our other public spaces. Before I touch on ACL's work related to blindness and low vision, I really want to start by thanking each of you. Thank you for the incredible work and advocacy that you do each day. As Clark mentioned, before joining ACL, I had the chance to work with ACB on a number of issues. And since joining ACL, I've seen your incredible advocacy, particularly related to the pandemic. I know I don't need to tell you the ways that people with disabilities have been so impacted, from facing higher risks of COVID, to losing services or losing jobs, to facing social isolation. And so many of you have worked so hard to make sure everyone has stayed as safe as possible and creatively worked to help meet people's most pressing needs. At ACL, I truly feel like we have been in this battle together with the entire disability community. And again, for everything we've done, thank you. COVID-19 continues to be the priority for ACL and the administration. In order to do our job at ACL, and we really are in a unique role, serving as the advocacy voice within the federal government, we must engage with stakeholders. And we've really appreciated, and it's been critical to hear from so many people across the disability throughout the pandemic, hearing from you directly about what is and isn't working, and getting your input on what is needed and what solutions are possible. At ACL, we take the community's input, and it's really informed the work that we've done across the federal government, working with the White House, the HHS COVID Task Force, the Equity Task Force, the CDC, and so many other federal agencies to ensure that the unique needs of people with disabilities are always considered. From the moment I arrived at ACL, at the time when vaccines were just beginning to be rolled out, we have been focused on addressing barriers. Our goal is that every single person with a disability who is willing to get vaccinated and now boosted can do so. In March of last year, we launched a first of its kind partnership with the CDC, where they provided us $100 million to improve vaccine access for people with disabilities. That funding has helped our disability and aging networks that are on the ground in local communities across the country to provide direct assistance to people in accessing vaccines. And that's included everything from helping people to register for vaccines and boosters, to identifying accessible vaccine sites, to providing transportation and in-person supports during vaccinations, to providing in-home vaccinations when those are needed. We also used a part of that funding to launch the first national hotline to assist people in connecting with local services, called the Disability Information and Access Line, or DIAL. This hotline can provide assistance and connect callers with local resources on a range of COVID and non-COVID issues. Everything from helping people connect with those on the ground supports to getting vaccines and boosters, to helping connect people with community services, to addressing housing, nutrition, and other emergency needs. We've assisted more than 30,000 people with disabilities through DIAL since the launch last year. And this is another place where we are very interested in community feedback about how DIAL can best meet the needs of our diverse disability community, including, of course, people who are blind or have low vision. Ensuring equal access to vaccine programs is not just the right policy, it's the law. And that's why last year, ACL collaborated with HHS's Office for Civil Rights, or OCR. OCR issued a guidance document describing the legal obligations of public entities to make vaccine programs accessible to people with disabilities. And ACL issued a companion best practices document, highlighting how our networks were partnering with public health systems to ensure access. These documents include a focus on legal requirements and strategies, focused on accessibility of vaccine websites, accessibility of information provided to patients, and the actual accessibility of vaccine sites. And our work at HHS has complemented enforcement work by the Department of Justice, including some of their more recent work to address inaccessible vaccine websites. I want to turn now to talk about COVID tests and masks. When the administration recently announced its program to distribute at-home COVID tests and then shortly afterwards masks, ACL worked to identify ways that we could help address barriers that people with disabilities might face in accessing these programs. Since the launch of the testing program in January, DIAL has been a resource to assist with ordering tests, providing instructions in alternative formats, and helping people understand how to administer and read the results of tests. Last month, we expanded the ways that DIAL can assist people who face barriers in using in-home tests. DIAL can now assist people with getting alternative swab and send tests, where the test is mailed in and the lab provides the results to individuals. For people who cannot use in-home tests, Dial can connect callers with local resources for in-home testing programs or transportation and companion support at a community-based testing site. We recognize that these options may not fully meet everyone's needs. And that's why, in addition to the work that ACL is doing, other components of HHS, including the National Institutes of Health and the Food and Drug Administration, are working quickly to develop more accessible at-home COVID tests. ACL has also recently launched a partnership with the Health Services and Resource Administration, or HRSA, to get in-home tests en masse to people who face barriers in leaving their homes. Through this partnership, our disability and aging networks can order tests en masse through HRSA's community health centers and rural clinics. I want to briefly touch on an issue that I know has been an area of advocacy for ACB, telehealth. During the pandemic, telehealth has greatly expanded, and certainly for some people, it has made healthcare easier to access. But we have also heard from stakeholders about the barriers that some people with disabilities face in using telehealth due to inaccessible platforms or websites, again, including from people who are blind or have low vision. We've been working with colleagues across HHS, including the Office for Civil Rights and HRSA, to improve the accessibility of telehealth services for everyone with a disability. And again, we'd really appreciate the opportunity to continue to work with you on this important issue. In addition to all the work that ACL is doing directly, ACL's disability and aging networks, which are in every state and in local communities across the country, have been providing crucial assistance throughout the pandemic. Although in ACL, we do not have any programs that we implement that are specifically targeted to people who are blind or have low vision, a number of our cross-disability programs do include a focus on providing supports for and addressing barriers faced by people who are blind or have low vision. For example, ACL funds protection and advocacy agencies, or PNAs, in every state to provide legal advocacy and protect the civil rights of people with disabilities. Examples of works that PNAs have done throughout the pandemic on behalf of hundreds of clients who are blind or have low vision include addressing inaccessible vaccine and booster websites, advocating on behalf of students who were denied a free and appropriate education during the pandemic, and addressing barriers to voting. Again, all on behalf of clients who are blind or have low vision. ACL also funds assistive technology programs in every state and territory. And I'd like to highlight one of the programs in Georgia called Tools for Life, who has worked closely with the CDC to improve accessibility of COVID-19 public health materials. Tool for Life produced accessible public health materials that included ASL videos, documents with minimal text complexity, and Braille materials. They ensured that the materials and CDC websites met or exceeded Section 504 and other standards, and were usable with a variety of assistive technology devices. ACL helped spread the word about this effort and worked to ensure that other state AT programs were aware of this effort. And other AT programs have worked throughout the pandemic to ensure continuity of services to people who are blind or have low vision. For example, AT in New Hampshire worked with New Hampshire Services for the Blind and Vision Impaired to put on a series of workshops focused on accessibility. We also provide grants to universities that support people who are blind through 13 of our grants to university centers on excellence in developmental disabilities. ACL also funds Centers for Independent Living, or CILS, which provide independent living services to people with disabilities. These services can include everything from connecting a person with needed community services or housing to assisting with finding a job or learning how to advocate. One example of Some work that SILs have done on behalf of your community include the Lake County SIL in Illinois. And I just want to share this story, which exemplifies what we hope our SILs can be doing on behalf of blind and low vision consumers. On behalf of a consumer who was legally blind and also had a physical disability, they provided needed orientation and mobility training. They arranged for several meetings with an orientation and mobility instructor and really assisted this consumer in being able to live independently. In Washington, D.C., where the D.C. Center for Independent Living engages in work, I want to highlight some work they did to provide Chromebooks to low-income blind and low vision residents. The DC SIL also established peer groups, such as the Blind and Visually Impaired Men's Group, the Blind and Visually Impaired Women's Group, and a youth group. And the DC SIL is very active in providing JAWS, Braille, and smartphone training to consumers with low vision. From our engagement with stakeholders and throughout discussions with the ACL team, it's clear that some SILs, like the ones I just highlighted, are doing a good job working with consumers who are blind or have low vision. And to be honest, some are not yet excelling. And this is one area where we'd really welcome your input and feedback about how we can support SILs to better serve your community's needs. ACL also has a center focused on disability research, our National Institute on Disability Independent Living and Rehabilitation Research, or NIDLR. And I want to touch on a couple projects that NIDLR funds for people who are blind or low vision. NIDLR funded the Smith-Kettlewell Eye Research Institute in San Francisco to create an accessibility-first website that makes pandemic data sourced by Johns Hopkins University accessible to people with visual impairments. They also funded the efforts of the Center on Employment of People Who Are Blind or Have Low Vision at Mississippi State, which has really worked to advance employment opportunities, including throughout the pandemic. NIDLR is a primary financial supporter of the National Research Center for Parents with Disabilities at Brandeis, of which ACB is a national dissemination partner. And this center focuses on the parenting experiences among people with a broad range of disabilities, including blindness. And as I speak, NIDLR has an open funding opportunity right now for a new rehabilitation engineering research center on blindness and low vision. If you're interested in this opportunity, please feel free to visit acl.gov and visit the announcements page. I know I've just gone through a really long area of list of areas where ACL is actively engaged or where we are funding efforts to ensure the rights of people who are blind or have low vision. And of course, this list doesn't include everything. I do want to just mention, even though I am focused today in my comments on COVID, that I haven't even touched on the many non-COVID areas where I hope we can collaborate with all of you, including in particular our shared interests around disability employment. I want to close by thanking all of you again for your incredible advocacy and for helping ACL know what issues you are facing in your communities. Your collective voice is making a difference, and though progress is never as rapid as all of us would wish, we are making progress together. We can continue to make a difference for the millions of people who are blind and have low vision. If you want to reach out to us, please visit acl.gov. I'd encourage you to sign up for our alerts and to follow us on social media. We really try to get information out to our community, things that are happening across the federal government that are of issue and interest. We know that community engagement is crucial to the work that we do, and I really want to invite Clark and Swatha and others to please reach out to us. We really want to hear from you and hear from the community. We're a small agency, but we truly try to leverage the resources we have and think outside the box for solutions. And we work together with our disability and aging networks across the country to try to meet the most pressing needs on behalf of our community. Again, thank you for having me here. Thank you for listening. And as always, thank you for your advocacy and partnership. And with that, I will turn it back to you.